Okay, so macroscopically, grossly, Waterhouse-Friderichsen syndrome looks like that. You see that these adrenal glands are fixed in formalin. That there is some kind of the black color of this adrenal glands. Anyway, you must realize that this is the huge, massive hemorrhages in both adrenal glands. What are the other features of septic condition? In case of the septic condition, we may also find such a complication as the cholestasis of sepsis. Cholestasis of sepsis, you may see on this histological image, the accumulation of the bile pigment. Why it may happen? That may happen due to the massive release of vasoactive substances, which may also impact on other organs with the smooth muscle cells. So as you may know, the bile ducts also contain the muscle cells to perform the normal peristalsis of these bile ducts. Finally, the paralysis of them and overdilation of them may finally lead to the features of mechanic jaundice. So that's the cholestasis of sepsis. So that's another image on the lower power. You may see the dilated bile ducts, dilated choledocs, and bile ducts and bile capillaries, which are filled with the literally lakes of bile. Next point of our lecture, that's the infective endocarditis as the quite special disease, which is basically associated with the vast majority of cases associated with the septic condition. Why? I guess you will understand it in a few minutes. So first of all, just to recall you that there are different types of endocarditis. You may see the rheumatic heart disease endocarditis, and with the development of very, very small vegetations on the atrial part of the mitral valve. In contrast to that, the Lehmann-Sachs endocarditis may demonstrate the development of vegetations on both sides. But basically, neither Lehmann-Sachs endocarditis nor rheumatic heart disease don't demonstrate the development of the large vegetations with the formation of the thrombi. In contrast to that, the infective endocarditis is associated with the development of the massive destruction of the valves, like mitral valve or aortal valve, and finally, okay, just accept some newcomers. Well, and development of the destruction, for example, of cords in the mitral valve, and potentially, since there is the thrombosis in this site, there is the potentially risk of the thromboembolism development. Okay, I just mute all the people. I mute you all. Sorry, I need to have a silence so far. Good. Good. Well, what you may find, oh, it's like a game, you know, I'm just trying to keep lecturing and manage participants. That's quite hard. I'm just distracting, but anyway, we can survive. You may see on this gross image development of subacute endocarditis caused by Streptococcus viridans. previously it was the myxomatous mitral valve, and every time when we have a deal with the infective endocarditis, you may keep in mind that if there is an infective endocarditis, must be some predisposal condition. Basically, it could be some hereditary disorders, some hereditary defects of the valves, valve failures, and you will see that in the clinical case presentation later. So here and on the next image, you may see the massive injury of the valve leaflet, like here on the aortic valve, with the development of ulceration, and in other hand, the formation of the vegetation. So this vegetation okay. This vegetation, in fact, must be considered as the thrombus formation. But these thrombi, since they are associated with the bacterial infection, also must include some colonies of the bacteria. And for that reason, I want to show you the virtual slide. I already prepared that. Okay. So there is the new image on your screen. So that's what I prepared. That's the corpse, what I prepared for the autopsy today. So don't worry, it's ready. And also I prepared some virtual slides for you. So what is the virtual slides? That's what I talked about, the bacterial endocarditis or infective endocarditis, if you wish. So how it looks like. So let's follow my description. This is a very good site, BioAtlas. You may choose different species like human species or even zebrafish. So now it's not point of our interest in zebrafish, but rather human bacterial or infective endocarditis. So look, that's the very low magnification. See, here you may see the shape of the valve leaflet, right? So just to make sure that this is exactly the valve leaflet, you may see the normal structure, the not injured side of this leaflet, which consists of the connective tissue covered with the endothelium. You see the endothelial cells, and we just go into the site of the injury. So that's the leaflet, even some adipocytes you may find here. Oh my God, what's going on? So you see the severe inflammation. Severe acute inflammation consists mostly of neutrophils. You see the neutrophils here. So they're trying to respond to the infection, which is invaded to this site. And what's going on here? You see here the colonies of bacteria. That's violet color. That's the staining by hematoxylin, and that's the large clusters, large constellations of the bacteria which are invaded to the tissue of, I guess that's aortal clapper, aortal valve. So there is the necrosis of aortic valve. There is the inflammation on the border of this necrosis, and here are the guys which finally produce this damage. So that's the infective endocarditis, but for sure, that's not all the story. Since there is a huge injury, huge damage of the endothelium over here, the response to this damage is almost immediate. You see the formation of the fibrine thrombi. So together with the colonies of bacteria, we may see the pink substance. That's the fibrin, and this fibrin masses, that's the thrombus. So in fact, we have dealt with the mural thrombosis in this case. So what may happen with that? What may happen with that thrombus? It could be detached. It could be detached from this site and finally may cause the serious complications. Just go to our autopsy room and remind ourselves with the normal anatomy. So I just want to go, I want to enter to the heart. So unfortunately, it's becoming frozen. Too much memory required for this. Okay, the heart. So I need to reach the valve and to see what may happen if the thrombus will be detached from this side. Okay, so what I need to do, I just need to a little bit edit this side. What I need to do for the edition, so I need to remove some parts of this fact. So I just need the tools for that. If you didn't try that before, I guess I strongly suggest you to use this application because it's quite good for understanding or if you forgot something about the anatomy, you can work with that pretty good. Okay, I just return into the female. No, I don't need that. I don't need that. Switch to pan mode. Okay, okay, okay. So once again, I don't want to see that. I'm just hiding the parts one by one just to reach the valves. So look here. We need to enter the left ventricle. Okay, veins. We need this. We don't need this veins. Okay, mitral valve. You see, what will happen if this mitral valve will contain some vegetations with the thrombotic masses? For sure, they could be detached and then pass through the aortal valve into the, I just don't need this small arteries and veins, to the aorta, and then later by the aorta, these masses could be spread out by different branches of the arterial tree. For example, they can enter the carotid arteries and in such a way injure the brain. Then they can continue their passage to the abdominal part of aorta and imagine what will happen. It may cause the thromboembolism of different branches of the abdominal part of aorta with the expecting consequences like the formation of the infarction in the kidneys, infarction of the spleen, and these infarctions, as you remember, they are contaminated with the bacteria. So that's why this contaminated thrombi, bacterial, in fact, bacterial thromboemboli may develop the abscesses in different distant parts of our body. just want to go here. Here I prepared you the consequence of this thromboembolism. That's another virtual slide with the formation of abscesses in the brain. You see it here on the overview and image on the low power. So there are 1, 2, 3, 4 abscesses in the brain. You see the cortex, you see the white matter, and here you see the darkening. In fact, that's the accumulation of the leukocytes over here. So what is the abscess? Abscess is the accumulation of the neutrophils. So look here, on the higher magnification, you see the wall of this abscess, and this wall comprises plenty of neutrophils. So what we may, I guess we will see them. This resolution permits us to see the segmented structure of the nuclei of these neutrophils. So they are surrounding the necrotic tissue, and perhaps in this necrotic tissue, we may find the bacteria. So just to remind you how to investigate the site with the bacterial contamination, for that reason, we need to use the specific staining. For example, brown hope gram stain. That's the gram stain what we may apply for histological samples. So over here, we may find the presence of Klebsiella. That's another case, but just to demonstrate you how it works. You see the sites of hemorrhages, and that's Klebsiella colonies, Klebsiella bodies. They are exactly in the sites of the hemorrhages. So see, that's the bacterial particles. Good. I go back to our presentation. So I just want to continue this lecture because still some clinical cases are awaiting for you. Okay, gross image, we already passed it. Just it requires some time to turn to next slide. Was pausing a bit. Okay, infectious arteriitis. That's pretty sure the outcome of the thromboembolism of the bacteria that contaminated thrombi. You see the attachment of the bacterial thrombus within the artery. Finally, on this place, we may expect the development of either abscess or in resolution of that with the recanalization of this thrombus without any outcome, either weakening and destruction of the arterial wall and development of the first aneurysm. Sometimes we call it mycotic aneurysm. And as the most common consequence of the aneurysm, the development of the hemorrhage. Okay, I just want to mute all people again. Well, next slide. Next slide, that's another complication of the septicopyemia, which could be associated with the infective endocarditis. See, dissemination of the bacterial thrombi may lead to, for example, multiple abscesses in the myocardium. So apparently, the bacterial thrombi could be spread by the coronary arteries in this site, and along this coronary artery, you see along the branches, coordinated with the branches, we may see the development of the micro abscesses. Again, micro abscesses may be found in such organs as the hepatic tissue in the liver. You see the many microabscesses in the liver, and microscopically you see the cluster of the neutrophils surrounded with the newly formed connective tissue. That's kind of healing stage of this condition. Multiple abscesses, multiple microabscesses in the kidney. That's the acute hematogenous or septic pyelonephritis. Cerebral abscesses, gross image, what you already seen on the microscopy, but these abscesses are very, very huge. And finally, we reach the point of the clinical cases. So I guess you're ready. Now you can read. Okay, so I'm nosy immediately. So people, you can read this case and you may see that that's the case about 9-year-old woman. Congenital. Okay, people, please stop talking. I guess that's really hard. Okay, doesn't matter. I mute all people again because it became noisy. Anyway, you can answer in the chat. Do you have access? Do you have an access to the chat? I guess you do, and please write me the correct answers in this chat. I just want to see how do you understand this case. Okay, so I just mute all. Go to the chat and try to answer. What's that? Zoom group chat. Do you hear that? Okay, V. Okay, there is the answer from Kushal, that's B. Formation of immunoglobulin by lymphocytes, by B lymphocytes. Okay, I don't think that congenital ventricular septal defect, that's the suggestion that it could be associated somehow with that. I already told you that predisposal condition with different congenital failures, different congenital defects of the heart may lead to the development of the infective endocarditis. So people, we got 10 minutes and now we must finish that. That's why. Okay, ED. Okay, let's check. Let's check what's that. E. That's the correct answer. Exactly. E, because in fact, we got to deal with infective endocarditis in this case, this septic embolization, which are produced as cerebral abscess in this case. The tissue destruction that accompanies abscess formation as a part of acute inflammation processes occurs from lysosomal enzymatic destruction. Case number 2. Prepared? Ready, steady, go. 28-year-old woman with the 15-year history of recurrent thrombosis from a prothrombin gene mutation develops septicemia after urinary tract infection with Pseudomonas aeruginosa. She develops multiple infarcts and organ failure over the next 2 weeks. Which of the following organs is most likely to be spared from the effects of ischemic injury in this woman? Okay, brain, heart, kidney, liver, spleen. Which one is not injured? Is not injured by ischemic factor. So we got deal with multiple infarcts and organ failure due to the urosepsis. Urosepsis, just continue to discuss, continue to think about. Urosepsis leads to the spreading of infection through the vein. So septic thromboemboli so septic bacterial emboli, turn back to the heart, right heart, then go to the lungs, then from there to the left ventricle, from left ventricle to other organs. So apparently, eventually, almost all the systems, all the organs could be injured in this case. But from this couple of guys, there is one which could be spared. C, kidney. Okay, let's check if it's true. Oh my God, D. No, all of you are wrong. Why so? Because liver has a dual blood supply, and that's why this fact may spare this organ from the ischemic injury. Case number 3. 80-year-old woman with dysuria for 1 week now has a fever. On examination, temperature 37.9, pulse 103 per minute, blood pressure quite low, right flank pain. Urinalysis shows numerous WBCs. Her plasma lactate is increased. Urine culture and blood culture grow Escherichia coli. Which of the following is most likely to contribute to her cardiovascular collapse by triggering toll-like cell receptors? Remind you that toll-like cell receptor, that's the receptor of the pathogen-induced molecular pattern. Okay, what is the here? D? No, what's that? D, platelet activating factor. Okay, toll-like receptor perceive the appearance of first wave mediators. That's the PAMPs, pathogen-associated molecular patterns. What it could be? E, D, E, B. Okay, so those who wrote B, answered B, that's the correct answer because it must be lipopolysaccharide for sure. Lipopolysaccharide, that's the PAMP from gram-negative organism. And due to that, we got the downstream effect of the sepsis during development of the sepsis. Case number 4, 91-year-old woman hospitalized with sepsis. On examination, she has fever and hypertension. So what else? What else? Just want to mute again. Analysis of the microbiology laboratory findings shows that the organ is cultured are gram-negative bacilli. Which of the following substances elaborated by this organism most likely to cause this complex of clinical findings? Okay, people. In this case, we got deal with the gram-negative organism, what they may produce to induce the sepsis. B, exotoxin. B.
Sure.
A, Mercy Paul answered A. Okay, let's check. For sure, that's endotoxin. I told you that's the part of the bacterial wall, and that's the correct answer. Endotoxin. In case of gram-negative sepsis, it's classically mediated by endotoxin. That's the lipopolysaccharide component of the outer cell wall. And the last one, 35-year-old woman with a history of injection drug use has developed a high fever over the past day. On examination, again, that's noisy. I just don't know how to ask you to not talk, but just want to mute you. Okay, on examination, her temperature is 37.6, heart murmur is auscultated, blood culture is obtained, and grows Staphylococcus aureus. She developed a severe headache. A head CT scan shows an intracranial hemorrhage. Which of the following vascular complications has most likely occurred in her brain? So just write that in our chart. C, meningitis. So who's that? Priyadasani. D, mycotic aneurysm. B, hyperplastic arteriosclerosis. Again, B, hyperplastic arteriosclerosis. Okay, I told you about that. That's the mycotic aneurysm. Since we got to deal with the thromboembolism to the brain arteries, there is the risk of development of the mycotic aneurysm, which is basically is not associated with the fungi. It's just the traditional misnomer, but it's rather the result of the damage of vessel wall and development of the weakening of it and development of the aneurysm. Okay, that's all what I wanted to tell you. And in the very last minute, I just want to give you the take-home message, just to summarize this lecture. Sepsis encompasses a spectrum of illness that ranges from minor signs and symptoms through to organ dysfunction and shock. Second, sepsis ranks in the top 10 causes of death. That's why it's very important and still relevant. The pathophysiology of sepsis arises largely from the response of the host's innate immune system under the influence of genetic factors. The signs and symptoms of sepsis are influenced by the virulence of the pathogen, the portal of entry, the susceptibility and response of the host, and the temporal evolution of the condition. Sepsis is a clinical diagnosis. Microbiological investigations are commonly negative, and powerful molecular biological techniques are likely to make a substantial contribution to the treatment and diagnosis of sepsis in the next 5 to 10 years. Okay, thank you so much for your attendance. I guess it was useful. If it was useful, you can write it in the uploaded video on our YouTube channel. Please subscribe to our YouTube channel. You may find it following the link in our group in the Facebook. And I wish you to stay safe, to take care, to be happy and enjoy the ending of our academic year. I was really glad to see you and see you here. Bye bye.
Bye. Jai Mataji.
दीपक की मागी चूत
मारो
नवदीप